Good morning. Are you someone who sees opportunity first or risk first? And more importantly, do you know how it shapes your decision making? Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On viral healthcare, we look at the ideas spreading across healthcare and what it takes to implement them wisely and sustainably. So today we're going to talk about you. We're going to talk about your tendencies. On this podcast and LinkedIn Live, we've been talking about the types of characteristics of innovations that kind of lend us down the wrong pathway. We talk about decision-making systems. We talk about the ways that we set up our companies and whether we have the capabilities to do these things. But really underlying a lot of this, and something that isn't talked about very often, are your own characteristics, are your own tendencies. So let's break some of that down. And I want to talk about how understanding that is really critical to your decision-making process. So let me start with something that I'm really familiar with. It happened back in my medical school days. In medical school, we called people lumpers or splitters. What does that mean? Lumpers are the kind of people that see patterns in the data, see patterns in what the history and physical and the laboratories and all of that stuff shows together, and they tend to group things or lump things together. Splitters see the patterns, but they also want to focus on the detail. They see nuances, they see important signals that may be buried by grouping them together. And when we'd have people raise their hand, it happened every single time. People kind of knew intuitively whether they were a lumper or a splitter. And it's not really wrong. It's just your own natural tendency. And the key component about it is understanding how it might create blind spots. So I tended to be a lumper more than a splitter. The other way you might have heard about this if you're not involved with the details of medical school is many of you might have taken the Myers-Briggs personality inventory. And in that one, Myers-Briggs breaks down into two different categories: sensing, which is the detailed focused, let me get analytical, or intuitive, which is pattern of focused, or let me listen to my gut a little bit more. This exists everywhere. Everybody falls into this, and people process information differently. And how you do that impacts your decision-making process and sometimes the outcome. Here's a really important caveat, though, before we go much further down this. You're not necessarily one or the other. You might have a dominant trait, but in certain circumstances, certain contexts, maybe certain domains, you can behave differently at different times. So I think I suggested earlier that I was a lumper, and I tended to group things together to be able to get my arms around it, to categorize it, to be able to see more by thinking about things in terms of categories, except when I would go into the intensive care unit. When I was in the ICU, I got super detailed, super systematic. I actually had a really basic system that broke down everything in great detail. And the key reason was because I didn't want to miss that warning sign, that what I thought me a false positive later turned out to be one of those warning signs. So in different settings, you can do different techniques, and that's an important caveat to remember. The second important caveat, and I've kind of alluded to this already, both styles work and both have blind spots. Both have blind spots that are weakness. You have blind spots that are important to consider as you think about your decision making. So how does this translate into decision making in healthcare? So these tendencies in each of us, these own personality characteristics or styles or methods that we've adopted over the years, they tend to show up in how we interpret the data or whether we even have enough data. They show up in how we evaluate trends. Is it long enough? Is it significant enough? You know, we all want to be objective, but sometimes we have these nuances or ways of looking at the data that makes it appear differently. And most importantly, it affects how quickly we act. And that has both, again, positive and negative. So let me just say, if we look at the same innovation, one leader will see opportunity and another leader sees risk. And again, they both have their strengths and they both have the weakness, but they're different and they're not wrong. They're just different. And sometimes it leads to different outcomes in decision making. And it's really important. That's kind of what we're trying to get at today, is how those things show up in the decisions that you make. We think that we're really objective, and in reality, we have lots of tendencies, lots of biases. Another example I like to talk about in the quality improvement world are the early adopters versus the show me leaders. And again, it's just two different ways of looking at things. The early adopter tends to move quickly. They're much more comfortable with uncertainty, ambiguity. They see risk, but they have sort of put risk into its proper perspective, and they evaluate more on the upside. Is the upside worth me taking this gamble? The show me leaders, I kind of think about this like my dad, who came from Missouri. He was from the show me state. They want more proof. They want evidence. They want to see that the risks or the uncertainty have been diminished, not zero, but much more confidence that the uncertainty is less. And so they'll focus a little bit more on the downside risk. The key tension here between these two is speed versus certainty. And there are a lot of people that want a lot of certainty, and a lot of people very, very comfortable with lower levels of certainty. Let me put in a caveat to all this, though, because that's one of my themes that for this whole session is that, there's no such thing as all or nothing in this discussion. You can be at different times, different places. So I tend to think of myself as an early adopter. Our house is totally tricked out with the smart home features that drive my wife crazy. She and Alexa have fights on a regular basis. It's made it a little bit better now that you can change the voice, so we have a man's voice, and so my wife has less fights with Alexa now. But I like smart home things. I'm really an early adopter on that. But I have never once taken Waymo. You might have seen or heard about Waymo. Those are the driverless cars that are becoming ubiquitous. And a lot of the major cities now have these Waymos, and a lot of people are really talking them up. I just haven't done it. Maybe it's because I haven't had the opportunity, or maybe just because it doesn't really appeal to me that much. So while I might be an early adopter on the smart home stuff, I'm not an early adopter. I'm probably more in the show me piece on the Waymo example. So again, context, domain, situational, you can be different. And the question is to ask, why is that? What makes this different for me? Or why do I tend to look for less certainty and more certainty in different situations? So the risk orientation is that some leaders will naturally scan for what could go wrong. That's probably not my first thing. My first thing is to look for what could work. Does this really have the upside that they say it is? Is this really as big a deal? And so my assessment is all like the size of the impact, and other people is the size of the danger. And so whenever we're doing either one of those, the risk that we all have, and I've talked about this in previous episodes, is confirmation bias. We tend to look for things that confirm what our natural tendencies are. So if we're looking for upside benefits, we look all of those and probably diminish the risks. And likewise, if we're looking at the risks first, we probably diminish and underestimate the upside potential with it. So the important thing is it shapes which ideas you support, which one you reject, and even how you might communicate with your team. So this is kind of a very important way to think about it. One other major caveat is I think sometimes you can change over time. So the reason it changes is because you actually have experience that's shaped by past failures or successes. And usually failures are much more impactful in your memory, in what you think about, and how you assess risk and benefit. So let's take the example like of a golfer swing. If a golfer pushes it to the right, their real tendency is on the next drive to pull it to the left. That's kind of human nature. Our human nature is to overcompensate for our last biggest mistake when we're in a similar kind of situation. So that's a bias, and that's a thing to keep looking for, as a blind spot that tells you that you should be overcompensating rather than just gently twisting the driving wheel to a little bit of a more natural position. So the reason this matters is because most people don't spend very much time thinking about it. Most of us, and I'm guilty of this too, we think we're pretty darn objective. I look at these things with great analytical skills, with great systematic approaches, and that's a trap. The reality is everything we're doing is filtering through our style, through our personality type, through our basic tendencies, through the things of how we look at the world, our worldview, and we filter everything, even the components with that. So here's the risk. You're going to over-index. You're going to either be overconfident or underconfident based on your natural tendency, and you're going to miss what others very easily can see. So this is important as we think about how do we create an environment to cover those blind spots. I want to reinforce, I want to make really clear, and we've said this just about every podcast, we're not trying to predict the future perfectly. Nobody can really do that. Too many variables, too much complexity, too many what they call emergent phenomenon that we just can't anticipate. And so it's impossible to do that. We're not trying for 100% success. We're just trying for better decisions, more frequent decisions that are good, and then leading to more effective implementations. They're tied, this decision making, decision quality, and decision timing and implementation are all tied together. So we're going to discuss decision timing and decision velocity, and both characteristics can get you in trouble. So, for example, a detailed analysis looking for the risk and simply destroy time can destroy momentum. Momentum in decision making is really critical. And a promising idea, a strong idea, can fall by the wayside. Likewise, jumping in too early because of over-enthusiastic opportunity seeking misses major warning signs and can promote overconfidence and implementation barriers in the future. So both can work and both are problematic. So the real skill is awareness and figuring out how to balance those tendencies. So it's not about changing who you are. That's probably baked in, although you may have some recency bias or recent phenomena that push you to want to drive the ball to the right as a golfer or pull the ball to the left to overcompensate. But really, it's not about changing. It's about recognizing where you lean, when it helps, and when it hurts. So it's really important for you to ask this really basic question: what am I missing? When I'm in that process, what are my tendencies and how is that going to steer me wrong? How would someone opposite of me see this? And the important part is to build teams or decision-making processes with different styles, to surround yourself not with everybody who thinks alike. In fact, sometimes that can be very destructive to the team, and rewarding those different styles, because you may have a tendency to dismiss, minimize, overlook, underappreciate people that have different approaches to you that actually may cause them to go quiet, to not feel like they have psychological safety, to be in an environment where speaking up is just not the right thing for them to do. So we're going to tie all these things together. Your reaction is not neutral. So when a new idea comes along, your reaction is not neutral. It's shaped, it's filtered by your worldview, by your bias towards action versus caution, versus patterns versus detailed thinking. And they're really both really critical. So better decisions don't just come from better frameworks. They also come from understanding yourself and your team and how you tend to make decisions. So the next time you're evaluating a new idea, pause and ask, am I reacting to the idea or to how I naturally see the world? Really important. And then ask your colleagues that same question and see what they think. So next episode, we're going to take a step further into this. We're going to break down a couple of patterns and go specifically over ways that those personality types, those decision-making structures and thinking and worldview may get you into trouble and how you stay out of it. So I want to thank you for listening to Viral Healthcare. If this conversation was useful, share with a colleague who is navigating change. And if you'd like more thoughtful conversations about the ideas shaping healthcare, be sure to follow the show. And here again, I do this every week. Please send me your ideas. Please raise issues. Please push back. Ask questions. Come from a different angle. And if you have examples, I'd love to talk with you about it. I'm Bruce Spurlock, and I'll see you next time.